name is Bill Bradley. I'm the chairman of radiology at UCSD. I've been a member of the RSNA. I attended the RSNA for the first time in 1980, and I probably joined after my residency, so I've been a member 30 plus years. The RSNA has been the vehicle by which new research is converted into practice. This is accomplished through a number of different mechanisms. One is the presentation of scientific papers. Another is refresher courses, and this is all assimilated by private practice radiologists and academic radiologists that put the new discoveries to actual work. Now, about 20 years ago, the RSNA spun off the Research and Education Foundation as a separate entity, and that supports research at multiple different levels. So many of the researchers that we've supported have gone on to get other types of funding, like from the NIH. And in fact, the last time we looked at the numbers, for every dollar that the R&E Foundation has awarded, the investigators have gotten $40. So it's a very good return on investment, if you will. So RSNA is not just the place where everybody comes to gather once a year, but RSNA is actively stimulating research. There's no doubt that the RSNA has benefited my career, and I've tried to give back a little bit. I can remember submitting papers to the RSNA, and I remember when you could tell from the size of the envelope when you got your response whether your paper was accepted or not. And it was such a thrill to get a paper accepted. And then as I became a little bit more senior, I got invited to do refresher courses, and that was it was a real high for somebody doing academic MRI in my case. Radiology is alive and well. The challenges are who is going to be doing the radiology in the future, and exactly how is it going to be done. But imaging is really becoming the core of the diagnostic workup. It's definitely usurped the physical exam, which is unfortunate. So now with an MRI and some lab work, we can often make the diagnosis without ever even seeing the patient. So I think that's been a key game changer. And the thing is, we develop the technology, and then other specialties end up assimilating it. So for example, the OBGYNs are using ultrasound now to evaluate babies in utero, fetuses. So, and that's fine. That's what radiologists do, is we develop new technologies. So I would tell the residents that radiology is alive and well, and we just need to change with the times, with the Affordable Care Act and the new ways of getting reimbursed for our work, more value-based than volume-based. But I'd say it's a very exciting time to be in radiology, and the RSNA has helped bring it all together. What will radiology be like 100 years from now? It's interesting you ask that, because I'm a big Star Trek fan. And I believe we will have a tricorder of sorts in the future. I think it'll be handheld MRI. In fact, I was just talking to our chair of bioengineering a month ago about a magnet design that would allow handheld MRI. And once you couple that with advanced computing, you will have something equivalent to the tricorder. I think we're going to see the radiologists in the future, I believe, will be much more integral to the care of patients than they are now. We'll probably see that more on a 5-year or 10-year event horizon than 100 years. But we'll probably see more computer-assisted diagnosis to make radiologists more efficient in the future. But ultimately, radiology will remain the subspecialty of medical diagnosis, and we will always be at the center of the activities surrounding diagnosing the problem that the patient comes in with. So I think that will continue for the next 100 years. I have no idea what technologies we're going to have right then, but I'm sure that they will be very impressive. I'd love to come back in 100 years.